لبت خندون، دلت آروم.
It's okay to feel down sometimes, but depression is different. It causes persistent feelings of depressed mood, sadness, and loss of interest in things that ordinarily make you feel happy. Depression isn't one size fits all, and understanding your specific type is often the first step in creating a treatment plan. To help, let's take a look at the 7 most common types of depression. Major depressive disorder, or clinical depression, is a mood disorder marked by long-lasting symptoms like fatigue, depressed mood or lack of interest in activities, changes in weight or sleep habits, difficulty concentrating, feelings of worthlessness and guilt, and thoughts of death or suicide. With major depressive disorder, these symptoms will last more than 2 weeks, and sometimes months or years. In general, people with atypical depression experience symptoms similar to those with major depressive disorder, but with one key difference. Their depression temporarily improves if something positive happens. Other common symptoms are excessive eating or weight gain, excessive sleep, fatigue, weakness, and feeling weighed down, and intense sensitivity to rejection. Persistent depressive disorder is a type of chronic depression that tends to stick around for a long time. You might have some good days, but they're never long-lasting. Symptoms are similar to major depressive disorder with some key differences. They're often less severe. They've been ongoing for at least 2 years. Bipolar disorder is a mental health condition marked by episodes of extreme highs, known as manic episodes, and extreme lows, known as depression. Manic episodes can be extreme, causing risk to the person, affecting their sense of reality, and sometimes warranting hospitalization. But manic episodes can also be mild. Those are known as hypomania. Most people with bipolar also have episodes of major depression and diminished interest in activities. And physical and emotional symptoms like fatigue, unexplained aches and pains, and anxiety are common. Postpartum depression, or PPD, comes on during pregnancy and following birth. PPD is more severe than normal hormonal changes and the baby blues. Mood changes, anxiety, and irritability are not uncommon after giving birth. Additional symptoms can range from persistent lethargy and sadness to postpartum psychosis, a rare condition accompanied by confusion or hallucinations. If left untreated, some cases of postpartum depression can last up to a year. With premenstrual dysphoric disorder, symptoms are similar to those of PMS, but are so pronounced and severe that they begin to impact daily life. Common symptoms are extreme fatigue, feeling sad, hopeless, or self-critical, severe feelings of stress or anxiety, mood swings, often with bouts of crying, irritability directed toward others, and food cravings or binging. A person with SAD, or seasonal affective disorder, will experience depression, sleepiness, and weight gain during the winter months, but feel relatively fine in spring. It comes down to sunlight. Our circadian rhythm is our body's internal process that regulates the sleep-wake cycle. It's influenced by light entering through the eyes. So when there's less light, like in winter months, it can cause a disruption, often leading to depression. With depression, everything feels more challenging, whether it's going to work, socializing, or just getting out of bed. But there are things you can do to cope, like developing good nutrition and hygiene, improving your sleep, talking with your doctor, and sometimes even spending time with your pet or listening to your favorite music. Treatment is unique to each type of depression, from talk therapy to medication, to sometimes even a light box in those dark winter months. By becoming an advocate for your health, you can take control of your depression. Start by talking with your doctor. By understanding your specific type of depression, you can then work to manage your symptoms and tackle it head-on.
سیمیاروم، مشاوره آنلاین روانشناسی برای ایرانیان خارج از کشور.